Birth defects, also called congenital anomalies or congenital disorders, are structural or functional abnormalities present at birth that can lead to physical or intellectual disabilities, or even death. Birth defect, also known as a congenital disorder, is a condition present at birth regardless of its cause. Birth defects may result in disabilities that may be physical, intellectual, or developmental. The disabilities can range from mild to severe. Birth defects are divided into two main types: structural disorders, in which problems are seen with the shape of a body part, and functional disorders, in which problems exist with how a body part works. Functional disorders include metabolic and degenerative disorders. Some birth defects include both structural and functional disorders. Birth defects may result from genetic or chromosomal disorders, exposure to certain medications or chemicals, or certain infections during pregnancy. Risk factors include folate deficiency, drinking alcohol or smoking during pregnancy, poorly controlled diabetes, and a mother over the age of 35 years old. Many are believed to involve multiple factors. Birth defects may be visible at birth or diagnosed by screening tests. A number of defects can be detected before birth by different prenatal tests. Types: structural, for example, neural tube defects, cleft lip, palate, congenital heart defects. Functional, developmental, for example, metabolic disorders, intellectual disabilities. Key facts: an estimated 140,000 newborns die worldwide within 28 days of birth every year due to congenital disorders. Congenital disorders cause a further 170,000 deaths of children between the ages of 1 month and 5 years. Congenital disorders can contribute to long-term disability, which takes a significant toll on individuals, families, healthcare systems, and societies. 9 of 10 children born with a serious congenital disorder are in low and middle-income countries. As neonatal and under 5 mortality rates decline, congenital disorders become a larger proportion of the cause of neonatal and under 5 deaths. The most common severe congenital disorders are heart defects, neural tube defects, and Down syndrome, although congenital disorders may be the result of one or more genetic, infectious, nutritional, or environmental factors. It is often difficult to identify the exact causes. Some congenital disorders can be prevented. Vaccination, adequate intake of folic acid or iodine through fortification of staple foods or supplementation, and adequate care before and during a pregnancy are examples of prevention methods. Congenital disorders are also known as congenital abnormalities, congenital malformations, or birth defects. They can be defined as structural or functional anomalies, for example, metabolic disorders that occur during intrauterine life and can be identified prenatally, at birth, or sometimes may only be detected later in infancy, such as hearing defects. Broadly, congenital refers to the existence at or before birth. The proportion of under 5 deaths due to congenital disorders increases as other causes of under 5 deaths are controlled. Changes in causes of under 5 deaths as under 5 mortality rates decline. Causes and risk factors. Genetic. A minority of congenital disorders are caused by genetic abnormalities, i.e. chromosomal abnormalities. For example, Down syndrome or trisomy 21, or single gene defects, for example, cystic fibrosis. Consanguinity, when parents are related by blood, also increases the prevalence of rare genetic congenital disorders and nearly doubles the risk for neonatal and childhood death, intellectual disability, and other anomalies. Socioeconomic and demographic factors. Low income may be an indirect determinant of congenital disorders, with a higher frequency among resource-constrained families and countries. It is estimated that about 94% of severe congenital disorders occur in low and middle-income countries, an indirect determinant. This higher risk relates to a possible lack of access to sufficient, nutritious foods by pregnant women, and increased exposure to agents or factors such as infection and alcohol. or poorer access to health care and screening. Maternal age is also a risk factor for abnormal intrauterine fetal development. Advanced maternal age increases the risk of chromosomal abnormalities, including Down syndrome. Environmental factors including infections. Others occur because of environmental factors like maternal infections, syphilis, rubella, Zika, exposure to radiation, certain pollutants, maternal nutritional deficiencies, for example, iodine, folate deficiency, illness, maternal diabetes, or certain drugs, alcohol, phenytoin, unknown causes. While complex genetic and environmental interactions are proposed, most congenital disorders have unknown causes, including congenital heart defects, cleft lip or palate, and clubfoot. Prevention. Preventive public health measures work to decrease the frequency of certain congenital disorders through the removal of risk factors or the reinforcement of protective factors. Important interventions and efforts include ensuring adolescent girls and mothers have a healthy diet including a wide variety of vegetables and fruit, and maintain a healthy weight, ensuring an adequate dietary intake of vitamins and minerals, particularly folic acid in adolescent girls and mothers, ensuring mothers avoid harmful substances, particularly alcohol and tobacco, avoidance of travel by pregnant women, and sometimes women of childbearing age, to regions experiencing outbreaks of infections known to be associated with congenital disorders, reducing or eliminating environmental exposure to hazardous substances, such as heavy metals or pesticides during pregnancy, controlling diabetes prior to and during pregnancy through counseling, weight management, diet, and administration of insulin when required, ensuring that any exposure of pregnant women to medications or medical radiation, such as imaging rays, is justified and based on careful health risk-benefit analysis. Vaccination, especially against the rubella virus, for children and women, increasing and strengthening education of health staff and others involved in promoting prevention of congenital disorders and screening for infections, especially rubella, varicella, and syphilis, and consideration of treatment, screening, treatment, and care. Screening, health care before and near conception, preconception, and periconception, includes basic reproductive health practices, as well as medical genetic screening and counseling. Screening can be conducted during the 3 periods listed. Preconception screening. This can be useful to identify those at risk of specific disorders or of passing a disorder on to their children. Screening includes obtaining family histories and carrier screening and is particularly valuable in countries where consanguineous marriage is common. Periconception screening. Maternal characteristics may increase risk, and screening results should be used to offer appropriate care according to risk. This may include screening for young or advanced maternal age, as well as screening for use of alcohol, tobacco, or other risks. Ultrasound can be used to screen for Down syndrome and major structural abnormalities during the first trimester, and for severe fetal anomalies during the second trimester. Maternal blood can be screened for placental markers to aid in prediction of risk of chromosomal abnormalities or neural tube defects, or for free fetal DNA to screen for many chromosomal abnormalities. Diagnostic tests such as chorionic villus sampling and amniocentesis can be used to diagnose chromosomal abnormalities and infections in women at high risk. Neonatal screening. Screening of newborns is an important step towards detection. This helps to reduce mortality and morbidity from congenital disorders by facilitating earlier referral and the initiation of medical or surgical treatment. Early screening for hearing loss provides an opportunity for early correction and allows the possibility of acquiring better language, speech, and communication skills. Early screening of newborns for congenital cataract also allows early referral and surgical correction, which increases the likelihood of sight. Newborns may be screened for certain metabolic, hematologic, and endocrine disorders, many of which may not have immediately visible effects, The conditions screened for vary by country depending on prevalence and cost. Newborn screening is increasingly conducted even in low and middle-income countries. Treatment and care. Some congenital disorders can be treated with medical or surgical interventions. Access to this care may vary by country and by different levels of a health system, though complex care is increasingly available in low and middle-income settings. Surgery with good follow-up care can often mitigate the potential lethality, as in the case of congenital heart defects, or the morbidity, for example, congenital tallops, cleft lip, palate associated with structural congenital disorders. The contribution to reducing mortality and morbidity of this aspect of the treatment is often underestimated. Outcomes are improved with early detection at lower levels of the system through screening, referral and management at specialist centers in case of some issues, like cardiac defects, medical treatment for certain metabolic, endocrine, and hematological conditions can improve quality of life. A clear example is congenital hypothyroidism, where early detection and treatment allows full physical and mental development to healthy adulthood, whereas a misdiagnosis or unavailability of a simple treatment carries a risk of serious intellectual disability. Children with some types of congenital disorders may require long-term support, including physical therapy, speech therapy, occupational therapy, and support from families and community, who responds through the Resolution on Birth Defects of the 63rd World Health Assembly 2010. Member states agreed to promote primary prevention and improve the health of children with congenital disorders by developing and strengthening registration and surveillance systems, developing expertise and building capacity for the prevention of congenital disorders and care of children affected, raising awareness on the importance of newborn screening programs and their role in identifying infants born with congenital disorders, supporting families who have children with congenital disorders and associated disabilities, and strengthening research on major birth defects and promoting international cooperation in combating them, together with partners, who convenes annual training programs on the surveillance and prevention of congenital disorders, who is also working with partners to provide the required technical expertise for the surveillance of neural tube defects, for monitoring fortification of staple foods with folic acid, and for improving laboratory capacity for assessing risks for folic acid-preventable congenital disorders, and is assisting low and middle-income countries in improving control and elimination of rubella and congenital rubella syndrome through immunization. WHO develops normative tools, including guidelines and a global plan of action, to strengthen medical care and rehabilitation services to support the implementation of the United Nations Convention on the Rights of Persons with Disabilities. Summary: birth defects arise from genetic, environmental, or unknown causes. Often, multiple factors are involved. Genetic factors: chromosomal abnormalities, for example, Down syndrome; single gene mutations, for example, cystic fibrosis; environmental factors, teratogens; single gene mutations, for example, cystic fibrosis; environmental factors, teratogens; infections, for example, rubella, Zika virus; maternal health conditions, for example, diabetes, obesity; substance exposure, for example, alcohol, certain medications, tobacco; nutritional deficiencies, for example, folic acid; other risk factors; advanced maternal age; consanguinity; exposure to pollution or pesticides. 3. Prevention strategies: primary prevention before conception or during pregnancy; maternal health optimization; folic acid supplementation for 100-800 mcg daily preconception and during early pregnancy to prevent neural tube defects; vaccination, rubella, hepatitis B, and others as per national guidelines; infection prevention, use of insect repellents; hygiene practices, avoiding raw undercooked food; control of chronic diseases, proper management of diabetes; hypertension, and obesity. Avoiding harmful substances, no alcohol, tobacco, or illicit drugs. Caution with medications. Genetic counseling, especially in high-risk families or consanguineous marriages. Secondary prevention, early detection and intervention. Prenatal screening, ultrasound, maternal serum markers. Non-invasive prenatal testing NIPT. Newborn screening for metabolic or genetic disorders, for example, phenylketonuria, hypothyroidism. Diagnostic tests, amniocentesis. Chorionic villus sampling in high-risk pregnancies. Tertiary prevention management and support. Early intervention services, speech therapy. Physical therapy, special education. Surgical corrections for structural anomalies like cleft palate or heart defects. Family support and rehabilitation, counseling, access to assistive technologies. For public health approaches to birth defects prevention, surveillance and research. Establishing birth defects registries and surveillance systems, promoting epidemiological studies to understand causes and trends. Policy and programs. National birth defects prevention programs. Integration into maternal and child health services. Universal health coverage to reduce barriers to care. Health education and communication. Raising awareness about risk factors and preventive measures. Promoting healthy behaviors among women of reproductive age. Workforce training. Capacity building of health workers in prenatal care. Genetics and birth defect recognition. 5. Global initiatives and guidelines. WHO Global Strategy on Birth Defects focuses on prevention, care, and surveillance. March of Dimes and CDC provide global guidance on prevention and research. Sustainable Development Goals SDG 3 address maternal and child health, which includes birth defects. 6. Challenges in low and middle-income countries. Limited access to prenatal and newborn care. Inadequate folic acid fortification programs. Cultural taboos and stigma. Lack of surveillance and genetic services. 7. Recommendations for health systems. Ensure universal access to folic acid via supplements or food fortification. Integrate birth defects prevention into reproductive and child health programs. Strengthen antenatal care and genetic counseling services. Establish interdisciplinary teams for management and rehabilitation.
Subscribe and follow My Health by Dr. J for more health videos.